it could vary in terms of the hospital stay. Um, you could have a patient that has recurrent stones and comes to the emergency room and gets hyperhydrated, gets their pain medications, and is discharged. Then there's the other part where patients come in, and you're talking about really young patients that come in without a diagnosis, and they come in full-blown renal insufficiency with kidney stones that are just seen in multiple scans in both sides of the kidneys. And requires a variety of different tests to evaluate what the potential differential diagnosis could be for this particular patient until the genetics come back. If the patient has acute renal failure and requires dialysis, then the dialysis is very frequent. It's basically daily and for about 4 to 5 hours a day. So it could be pretty cumbersome for some patients. And then you have the other patient population that may have systemic oxalosis. So the patients that may have complete shutdown of their kidneys because of the condition. And now the oxalate starts to accumulate in other organs and other tissues, specifically the heart, which can cause cardiomyopathy. It can accumulate in the bones that can result in severe pathological fractures. It can accumulate in the eye that can cause vision loss. So it can accumulate in a variety of different tissues. And so that, of course, requires further monitoring. So not only is it that patients come in for hospitalization, but patients that do progress to renal insufficiency, they do require intensive care, especially patients that are dialysis dependent.